Hello everyone. I am Dr. Devyansh Nimodia, Junior Resident, Department of Radiology, JNMC Savangi Mekhe. My topic for paper presentation is Grayscale and Color Doppler Evaluation of Extracranial Carotid Arteries in Patient at Risk of Developing Cerebrovascular Disease, a Clinical and Radiological Correlation. Introduction. Stroke is considered as one of the leading cause of mortality in adult population, especially in those over 50 years of age. The survivor usually develop a prolonged or irreversible disability. Almost 80% of stroke episodes are due to thromboembolic episodes, with carotid plaque being the most common source of emboli. Clinical studies of carotid artery disease have been classified patients into two groups, symptomatic and asymptomatic. The symptomatic group include patients that have or had a neurological event, that is stroke, transient ischemic attack, or amaurosis fugax, secondary to cerebral ischemia, likely as a result of embolic event arising from atherosclerotic disease in the carotid arteries. The at-risk or asymptomatic group include patients who have not had a neurological event and who have various clinical risk factors which may lead to diffuse atherosclerosis. The overall prevalence of significant stenosis in symptomatic patient is in range of 18 to 20%, while in the asymptomatic patients referred for carotid imaging, it is around 14%, which is very close to symptomatic group. Hence, it becomes equally important to screen asymptomatic patients in order to avoid a major thromboembolic episode. Various techniques are available for imaging the carotid arteries, such as high resolution ultrasonography, conventional angiography, CT, and MRI angiography. On review of Doppler ultrasound data, high sensitivity and specificity 84 to 99% and high accuracy 90 to 95% have been reported. Additionally, being cheaper and easily available, ultrasonography is considered as the primary imaging modality for screening of the asymptomatic group. Aims and objective to evaluate intima media thickness, plaque morphology, criteria for grading stenosis, and hemodynamic changes occurring in the carotid arteries in patients at risk of developing stroke. Method and method. My study centers Acharya Vinoba Hospital, Savangi, and Jawaharlal Nehru Medical College. This is a prospective observation study. The study was carried out on 60 patients on Siemens Acusen Anacris and Sonosite. Inclusion criteria: age more than 40 years of both gender, hypertension, diabetes mellitus, smoking of more than 10 years history, alcohol intake, hyperlipidemia, and coronary artery disease. Exclusion criteria: systemic diseases, trauma. My sample size was 60 patients. Imaging. Grayscale imaging for plaque characterization and intima media thickness assessment. Color Doppler imaging was performed to detect areas of abnormal blood flow that require Doppler spectral analysis. Pulse wave Doppler spectral analysis was performed, and the velocity of blood flow in the mid common carotid artery and proximal internal carotid artery, as well as proximal to, at, and immediately distal to diseased area was measured. Color and pulse wave Doppler imaging of both vertebral artery was performed to rule out presence of a subclavian stele. Result: the study was carried out in 60 patients using a high frequency linear probe, out of which 24 patient, 40% were female, and 36 patient, 60% were males. Side: slight predominance of atheromatous plaque formation was seen in the right side carotid, that is 53%. Abnormal intima media thickness was noted in 37 patients, out of which 23 were male, 14 being hypertensive, 12 gave history of smoking, 7 were diabetics. Age distribution. In 40 to 45 age group, there were 4 patients, accounting for 6%. In 45 to 50 years, there were 12 patients, accounting for 20%. In 50 to 55 years age group, there were 10 patients, accounting for 16%. In 55 to 60 years, there were 11 patients, accounting for 18%. And in 60 to 65 years, there were 23 patients, accounting for 38.3%. Risk factor: 60% was smoking, 18% was hypertension, 11% was diabetes mellitus, and 11% was other. Site of plaque formation: 40% was in carotid bulb, 20% was in common carotid artery, 37% was in internal carotid artery, and 3% was in external carotid artery. Plaque characterization: 15 were echogenic, 12 were hypoechoic, 6 were heterogeneous, 9 were calcified, and 1 was ulcerative. So, this is a grayscale B mode ultrasound image showing increased intima-medial thickness, measuring approx 0.09 centimeter in common carotid artery. This is grayscale B mode ultrasound image showing hypoechoic plaque in right common carotid artery, measuring approx 0.38 into 0.21 centimeter. This is grayscale B mode ultrasound image showing external carotid artery, left external carotid artery plaque, measuring approx 0.68 into 0.17 centimeter. This is grayscale B mode ultrasound image showing calcified carotid bulb plaque. This is grayscale ultrasound image showing stenotic plaque in the right common carotid artery, measuring approx 0.1 into 1 centimeter and 0.1 into 0.7 centimeter. Discussion: all the patients were scanned for both CCA, ICA, and ECA. B mode, color mode, and spectral wave were studied with a 7 to 11 megahertz transducer as the cardiovascular system is situated superficially. The higher frequency allows better resolution and adequate penetration with an acceptable field of view, which is in accordance with Krebs and Ghiani study, who also advised the use of high frequency transducer for imaging of carotid vessels. The commonest lesion found in our study was the atherosclerotic plaque. Out of all patients examined, 17 had no lesion in carotid arteries, that is 28%, and 43 patients, 72%, had atherosclerotic plaque. The anatomical side of involvement and plaque and the percentage stenosis was calculated. The right side was affected more than the left side. 22 patients presented with plaque on the right side as compared to 14 on left side and 7 presenting bilaterally. The commonest site of involvement was found to be carotid bulb, followed by ICA. The ECA was least affected. Carbedal and Phillips et al. Found the commonest site of involvement in carotid bifurcation, followed by ICA and intracranial portion of ICA. The commonest risk factor in a study was found to be smoking, which is in accordance with a study done by Vaishnan et al., who found that chronic cigarette smoking is a strong predictor for severe extracranial carotid atherosclerosis. Conclusion: endarterectomy has proven to be beneficial in more than 60% asymptomatic cases with carotid stenosis. Hence, screening for presence of clinically occult disease has become important. Grayscale and Doppler evaluation of the carotid system can assess the prognosis in asymptomatic patients who are at risk of stroke development and who can benefit from endarterectomy. These are my references. Thank you.